to advance the... okay. I am the older vice president and my voice is the same as my age. Of course, I will talk you about HTA as every year. Probably I want to show you how this topic is a political one and not a scientific one. I hope at the end of the presentation you will understand that it is an important political topic for UMO and not a scientific topic for Wonka. I participated at different networks. The HTA network stakeholder pool is the network who collects all the stakeholders such as healthcare professionals, such as industry representatives, such as patient associations, and also insurance, private or national. This meeting in January in Brussels, the thematic was how to facilitate appropriate involvement of all interested stakeholders. You see there that a stakeholder is only a person interested by a topic and also who can bring some input in the topic. It is a European definition of a stakeholder. We had the presence of Patrick Ouvrard, since those sessions are mainly divided in two workshops or three workshops, and it is good to be two as my colleagues at the European Medical Agency. And it was discussed about the contribution to HTA of all the stakeholders at the EU level. How can we contribute, and also to ensure that the view of the different stakeholders are taken into account. And also the idea of the European Commission is that we can have contact together between stakeholders. Other point discussed was the development of a transparent and solid conflict of interest policy, since it is very important that when some people are interested in HTA, those people are not submitted to conflict of interest. And we had a very good presentation of Giovanni Tafuri about this. It is interesting to see that if this policy is implemented at the European level, some patient organizations have to change the statutes of their organization, since they are often sponsorized by industry. It is not the case for UMO. We can go in this context without any problem. We had also a parallel session where I was a presentation about the involvement in the joint HTA work with the presentation of Eurordis. Eurordis is a patient organization whose work is to defend the rare diseases. And they presented their suggestion for the participation of patients. And for me, it was also the opportunity to say that we had also a participation in the SMART project that can be a model of the contribution we can give to the HTA. And Patrick was also there, and he will speak about his workshop. It is quite difficult to see this picture, but you will have it in the website. You can see better. The patient association think that it is important that patient associations are approached by HTA and that they can answer individually or in focus group. Focus group is the same that we have done as Healthcare Professional Association with the SMART project. And as UMO, it is difficult to profile ourselves as experts. An expert in the sense of HTA is a person who has a specific competency in a very small subject, for example, in genetic medicine or so on, and, or in cardiology. Some people of the Cardiologic Association can be interrogated as experts. We are experts of the globality, and it's perhaps better to say that we are professionals of health. We are professionals, and not experts. We are experts of the globality, and we are not stakeholders. Stakeholders is a very large definition. Everybody can be a stakeholder. We are professionals, and we have to defend our position as professional, not as stakeholders. And the healthcare professionals are defined in the European law, in the directive on cross-border care. We defended this position at the HTA group. And the mode of contribution we can give as a professional, not as experts in the UMO, can also be on the model of the contribution we had given in the SMART study as the proposal of the patient association. To be more horizontal and to collaborate with other organizations, we had published this statement in the BMG after the editorial of Fiona Goodley. Why aren't medical devices investigated in the same way than medicines, regulated like drugs? And it was important for us to make a statement in this journal to show that we are a group of European healthcare professionals that can have an advice on this question. It is the finality of HTA, the finality. We have centered the finality in this paper on the primum non nocere, on the quaternary prevention. We must be aware of quaternary prevention. We must be aware of the risk that a new device can be for a patient. And if you see the signatures of this paper, it was on the initiative of UMO. We are the principal signatures of the paper, but we had also 3 associations of patients and also healthcare professional association. We had another meeting in March, but only organized for healthcare professionals. And it was for us the opportunity to define better these 2 different positions. The position of expert and the position more horizontal of a professional who defend a profession, who defend some principle of a profession. And this is, I think an expert is not, to be an expert is not to be in a political way of functioning. It is a scientific expert. But in the definition of the European Commission, this second way, more comprehensive or horizontal, is to bring our competency as a medical association, as a professional association. And this definition was accepted by the European Commission. It was a meeting that I was presiding with Flora, who had to come, Flora Giorgio, who presided the group of HTA at the European Commission. And Flora is not here while she is ill today, as I am. But I am here, but Flora is not here. You know why Flora is not here? Flora is not here. Why? She has a GP, and the GP has given her working capacity of 15 days, and she didn't want to disobey to her GP. And I said to her that it is a good thing not to disobey to a GP. Even in the European Commission, they have GP. It's an interesting message. Okay. I was also with Patrick at the UNETA Amsterdam. UNETA is the organizatory pool of the HTA pool, and the question was to bridge UNETA and healthcare providers, and I animated a workshop with the president of EORTC, the European Organization of Research in Treatment of Cancer, to put in perspective that it is not sufficient to introduce a new medicine with a good evidence-based medicine, but we must be sure that the healthcare system is in capability to accept these new technologies. And what is more important than the introduction of new technology is probably the context where we introduce it. It is we must not simply introduce a new technology, but also ensure that the care pathway is adequate for patient. This idea is coming from Pierre-Louis Drouet, you know, the delegate, the president of the French delegation, who is now responsible of the pathway of care at the HAS, the Haute Autorité de Santé, who is in France the HTA decision group. And it's interesting to see that the position of a GP in this context is to defend probably more the context than a specific technology. After that, I was approached by my own organization, the FMH, who wanted to know more about this strange topic, HTA, and I made a presentation, and they asked me to make an article in our Swiss journal. For me, it was an opportunity to write an article to explain simply what is HTA, and you have this article in the website. We wrote this article together with Marie-Christine and with Patrick to remain simple, clear. Some of us have possibly read it yesterday during the night, but I have made a small resume of this article. This article will be published in French and German in the Swiss Journal of General Practice, and you have the English translation that we have made with Marie-Christine and Patrick. And I present you very simply this paper. The first paper is HTA and family doctor. What is technology? It is not so simple to define what is a technology. Etymologically, techne in Greek is an art, the art. Logi is the speech. It is the discourse about the art. And sometimes it is only a discourse, and not an art. Another definition is the application of science. This definition is used at the European level, the application of science. But we must remain in mind that for a GP, we have tools, and we must be men that master the tools. What is a health technology? We have two definitions possible. We have one definition from the European Commission. Technology is defined by the object of the technology. It is medicinal product, device, procedures, and measure of health. Punkt. No more. Nada más. But the WHO definition is the same, but they add that there is a finality, and the finality is to improve health and quality of life, to solve health problem. And there is no finality in the European definition. This is a problem that we had underlined in the discussion. Why evaluate health technology? It is an old story, since this story has its roots in Plato, in a dialogue of Plato, where the inventor of writing came to the king, and the king says, oh, writing, it's a good idea, but probably it's not good for memory. It's better that people can have memory. It will not improve memory if you write all what you say. And the king said to this man, you are not, as inventor, the best man to evaluate your invention. Your invention must be evaluated by others. I think this text is the foundation of the health, of the technology assessment. And the health technology assessment have two evaluations according to the European Commission. It can be an evaluation on clinical topics. It is only based on evidence-based medicine. But it can also be an evaluation on non-clinical topics. Non-clinical. What is a non-clinical assessment? It is an assessment where we take into account the ethical problems. For example, the king in the Platon story, it is the problem of memory. It is not good if your memory will not be improved by your invention. We can say the same for the mobile phone. It can be economic criteria. It can be also social criteria. And for the European Commission, only the scientific criteria must be taken into account for the HTA at the European level. And why Europe? The necessity of a health technology assessment at the European level is defined to avoid duplication of work and to also permit every country to have the same quality of care in Europe. It is defined in the Directive of Cross-Border Care. And why a role of GP in this topic, a political role of GPs? We can define ourselves as professionals, as craftsmen, and we need good tools and adapt these tools to individual situation. For us to have good tools and to have not dangerous tools is important. We have a role. I have not now, perhaps we will discuss it in the discussion group, in the working group this afternoon. I have not the good term to define our work. Are we in a guidance situation, in a mediation situation between the patient and technology? I think we are most professional experts. I like the definition of the discussion we had with the Spain delegation about professionalism. Probably it's the terms, but we can discuss the good terms we can use. What we have done in this context after 2 years of work in the HTA group, we every time get back to the clinic, to clinical situation, our lived experience as GPs in our practices. When I have a patient who is going in holidays and he has a heart attack in Bulgaria or so on, and he comes back in Switzerland with a stent, I must be sure that the same criteria are applied in every country. There is not over-medicalization in one country or under-medicalization in another. For me, it is important to have very simple clinical examples. In the paper, you will see some clinical examples. In this group, we had a role of information, of observation. It was interesting to see that patient organizations and industries are always discussing together. The patient organization want the best technology without any moment of retardation. They want to have the best now, and I can say that the patient organization are more technophilic than we. We are technosceptical, but our attitude is certainly primum non nocere, and also to be aware about the conflict of interest and to have good paper about the conflict of interest. Our observation on the European situation is to see that some countries are not interested by HTA, those countries who have a very heavy health technology assessment systems as Germany or France. Other countries are more interested. There are also some countries who don't want an intervention of the European Commission at this level. And there is a balance, difficult balance, between the voluntary assessment. I can ask the European Commission in a voluntary way to make an assessment, or in the regulation, the assessment is mandatory. Every new technology must be evaluated at the European level. Personally, I think for equity principle, it is best to have mandatory system than voluntary system, who is in favor of big and rich countries. We can establish common value also in our group of healthcare professionals. For all, the scientific evaluation is important. For all, the conflict of interest is a problem. For all, it is important not to harm. And for all, it is important to make this distinction between expert and professional. As a political association, our role in the HTA is to make the framework for the future work of HTA in Europe, and this is a political role. But when we have to find an expert, it is a scientific role. The experts can be, for example, from WONCA or from EGPRN, but not from the UMO. But our role as a political association is to participate on the construction of the legal framework for the future work on HTA. We had the possibility to express ourselves, and now I think that GP at this level exists. And what added value for us? Make ourselves known. If it is only this, I think it's important. The collaboration with other associations, the discussions, to say that what is important is to coordinate, and we have a role in the coordination in the pathway of care. It is also, we have to promote an horizontal organization of care and not a vertical silo of specialities. It is a thing that we have defended at this level. We have this role of professional guidance. We have also implemented in general medicine new methodology to assess or to make research. I think there is certainly in the EGPRN or WONCA group new methodology that we can implement for HTA. And we had also the opportunity to refine our values. And for the question that we had in this group many times, the fear of instrumentalization. UMO is there, UMO is only an alibi for the European Commission. I can say you that I don't feel to be an alibi. I think even if my voice is a little broken by the stress, I can express myself. And I had the opportunity to speak. Okay, it was for HTA. We have published in the beginning of the year these guidelines for adult obesity management with the European Association for the Study of Obesity. Here we are perhaps more in the limit of the role of political association and scientific association. It is an example that we can discuss. I am open to discuss this more as a scientific work then. But as Kjartan has said to us, the limit is sometimes difficult to define between the scientific work and the associative work. But we have to define as an associative work. You see there this lady who is the industry, who is presenting to the old doctor a new device. The old doctor has a site of septicism, and the patient has a site of hope. It is the context, but it is an old doctor. And we went in Paris with my young trainees, also as it is a congress where we were five members of UMO. and my young trainees who presented a workshop about uncertainty in general practice are the future of our work. And if we work as a political association, we work for them. Thank you very much.
Thank you, Daniel, for your presentation. I ask now Mary to present her activity in the last few months.
Thank you very much. This is the result of the surveys that I sent out earlier in the year and that you kindly completed for me. And it was suggested, if you remember,